we're going to go ahead and start. I'm recording, and we're just going to continue to go through our questions that were coming through. So the next question we're going to start with, unless there are any questions before we start. Are we good?
We good. Yeah, no, I'm good. All the questions I have can be resolved by me studying.
Okay. All right, let's see. Rob, why don't you take the first one? Which is considered a normal or healthy type of grief? And these are 4 different kinds of grief: anticipatory grief, complicated grief, unresolved grief, or inhibited grief. So which one of those do you think would be a normal type of grief?
Well, I can rule out 2 right out of the gate.
All right. Give it your best stab.
I'm going to say D.
D. Nope. It would be, I believe, anticipatory grief. Oh,
right. Those are the 2 that I had.
You were left with, right. So complicated would mean that it's not normal, unresolved, not normal, inhibited. Even if you don't know the types of grief, there's a saying we use, it's called DABDA, the stages of grief. And we'll give you those, what that means. But anticipatory grief is something that you will anticipate with people who are experiencing late life or the end of life experiences and processes.
So when you think anti, you think against?
Anti means usually against, yes.
Okay. I got you.
Wait a minute. Whoops. Oh, wait. I wasn't supposed to do that, was I? Oh, no. What did I do? There were 4 questions and I didn't get to finish it.
Yeah, 60 to 63, 3 more.
Yeah, I know, but maybe it was this. Let me see. I'll try to make it a little bigger. Will that be helpful?
That's good.
Yeah, a little bigger, big.
Okay. There you go, sweetie. All right. Which of the following approaches to work would not work for a nursing assistant? So we're looking for the exception. So all of these are correct except a team approach to working, an enthusiastic approach, a communicative approach, or an isolated approach. Which one would not work?
Isolated.
Correct.
Good job.
Good job. All right, Lena, how about this one to you? You want to give it a try?
Sure. Go ahead.
Okay. While performing your duties as a nurse assistant, you experience a coworker giving you a hard time. Which of the following approaches to the issue should you take? The first one, openly discuss the issue with the coworker. Second, privately discuss the situation with your immediate supervisor. The third one, discuss the employee's actions with other coworkers or walk away from the situation without completing the task.
I would have to go with those scenarios that we have up there.
Yeah.
I'm going to go with privately discuss the situation with your immediate super worker.
All right.
Because I don't think you want to openly discuss it, while you at the situation right there. It's not a good time to do it. And then discussing it with employee action with a coworker, you don't want to tell something about, you don't want to get the whole area uproar, so that's out.
Right.
And then to walk away, you definitely don't want to walk away because the patient is our number one concern. So I'm going to go with privately.
All right. And tell me why you would not openly discuss the issue with the coworker.
Maybe I'm reading it. If we're saying openly to discuss it with the coworker right then and there, no, it's not that's not the appropriate time or place to do it because I have a resident or a client in front of me at my concern to make sure.
Do you have a resident or client in front of you? You are just performing your duties. You're just going about your job, and this person's giving you a hard time.
Oh, okay.
You go, girl, right? You were reading into it. You were putting yourself in your workplace and you were like, I'm in front of my patient. I'm not going to talk to her about this in front of my patient. Is that where you were coming from?
Yep.
Which is absolutely appropriate behavior, right? None of us would do that. We're not going to pick a fight with our coworker in front of our patients,
Yep.
but it's not saying that. So which answer are you going to pick?
It's going to have to be openly discussed the issue with our coworker.
Okay.
Oh,
Very
that's
good.
crazy.
We got it right. Okay. So which of the following patients, let's see, Rob, back to you. Or did you get one? No. Is it Pam's turn?
No, it's my turn.
Oh, okay, Rob, ready? Which of the following patients would benefit the most from large print reading materials? A hearing impaired, B, a visually impaired, C, a hyperglycemic patient, or an anemic patient?
All right, so we're looking at a bold print called most. That's the key. Most from large print.
Yeah, which of these patients down
Visually
here would benefit?
impaired.
All right, correct. Very good. All right, Pam, you are up. The nurse exposed the patient's genitals while she changed the bandage on his lower left thigh. Which of the following options best identifies this action? Is it negligence? Is it battery? Is it invasion of privacy? Or is it assault? Think of our 6 principles of care. Oh, and is she on the phone?
Pam,
I
you
can't
got this,
hear her.
girl.
And you're on mute, Paula. There you go. Okay, Pam,
Negligence.
you think it's negligence? What's it, Paula, what do you think?
One.
I agree with her. I think it's negligence.
Negligence.
Not doing what a normal conscientious person would do.
Right, very good.
Good job, Pam.
All right. Lena, all of the following options are examples of contamination through droplet transmission, except, so which one of these things I'm going to read to you, conditions, are examples of contamination through droplet transmission? All of them are, except for one. The common cold, arteriosclerosis, influenza, or tuberculosis. Which one of those is not transmitted through droplet?
Artericulosis?
Yes, you are correct. Arteriosclerosis. And all that means is hardening of the arteries. Sclerosis is a suffix that means narrowing or narrowing of a vessel. So it just means narrow artery. Very good. All right, Rob, which one of the following options is the correct sequence for putting your PPE on? So when they say for donning the required personal protective equipment for isolation, it's the order that you will put your PPE on. So the first one is wash your hands, then put on your gloves, then put on your gown, then your goggles and your mask. The second one, wash your hands, put on your mask, put on your goggles, put on your gown, put on your gloves. Or C, wash your hands, put on the gown, put on the mask, put on the goggles, put on the gloves. Or D, wash your hands, put on the gloves, put on the mask, put on the goggles, and then the gown.
Paula will kill me if I get this wrong.
No, she won't.
Think of what
Yes,
you put
she
on
will.
first. Think of what you put on first and go from there.
Well, we know we're going to wash our hands first.
Yeah.
Right.
We're going to
So
put
what
on the
part-
gloves.
What part of the PPE went on first?
Mask.
Think about dressing up like
The
you did.
mask. No, my bad. The gloves.
Still bad.
Okay, wash hands.
What part of it did you put on first? What's the first thing that you put on after you washed your hands?
The mask.
No,
I don't
the
think
gown.
No. It
It's
was
the gown.
after I put on the mask, the first
No,
thing.
not the mask. The first thing you put on after the very first piece of equipment after washing your hand you put on.
When I handed you your little kit, what did you
Yes,
take out?
it was
and what
the
did you put on?
gloves, so it's D.
Nope,
Nope. It's C.
What is it, Lena?
it is
It's
right.
C. It's C.
It is. You put your gown on first because remember you put your gloves on
Over the gown.
over those.
Yeah.
All right, mask, goggles, and then gloves last. All right.
I knew, Paula, you're probably gonna split my throat the next time
She'll
I see you.
keep
But that's
testing
okay.
ya.
I'm good with that.
That's all
You
right.
gotta
You
practice.
won't forget it now, will you?
Right.
No, not now. I won't.
All right. So Pamela, you're up. If you are accidentally punctured by a patient's needle, you could be at risk for hepatitis B, diabetes, ulcers, or hypertension.
Hepatitis B.
Good job.
Correct.
Yeah.
All right. Lena, in order to protect the patient and yourself, you should always use proper body mechanics when you are doing all of the following except lifting patients, transferring patients, feeding patients, or ambulating patients. This is not a good question.
No.
What did you say, Lena?
I said feeding patients because you're gonna, you want to
You're
be
right.
proper stuff. When
Is that right?
Yeah.
Yeah, that's
It
But I'm
is
looking at the
right.
wording. That's all.
Well, but you know what's the problem with the question is you should be in proper body mechanics all the time, and
Right.
alignment. When we think body mechanics, we think alignment. So when we're sitting feeding, we don't want hunched over. So it's just not a great question.
right. Everybody should be sitting up properly.
That's right. All right, Rob, when you check a patient's vital signs, which of the following functions are you not doing? You're not going to take the patient's glucose level, take the patient's temperature, take the patient's pulse rate, or take the patient's blood pressure.
Glucose level.
Rightio.
Nice.
Bravo. All right, Pam, you're up. Which of the following statements is the correct process for using a sphygmomanometer, tympanic thermometers, and stethoscopes? So we're talking about our equipment and what is the correct process for using them. First one, you should always follow the facility's guidelines. B, you should always follow the guidelines you were taught in school. C, you should always use the manufacturer's guidelines. D, you should always ask your supervising nurse for assistance. So which is the correct process for using blood pressure machines, tympanic thermometers, and stethoscopes?
You should always follow the facility guidelines. You should always follow the guidelines of we're taught in school. So I would say I would follow the guidelines that was taught in school.
Second choice?
Yeah. The first choice is number one.
Okay. Try another first choice.
Should always use the manufacturer's guidelines.
There you go.
That's it, correct. And the reason that's not intuitive to us is because we show you the blood pressure cuff and, where are you going to look for the manufacturer's, guidelines. But typically you're using a Dynamap now that has it attached to it where these are the manufacturer's guidelines for using the equipment.
So question, it says, what is the correct process for using it, right?
Where would you find the correct process for using it?
Oh, well, I'm on the
Well,
wrong
it
one.
says, wait, I see what you're saying, Lena. Which of the following statements is the correct process?
Right.
So
And
the
so-
process, use the manufacturer's guidelines. is the process. You should always use that process of making sure you're following the manufacturer's guidelines.
Because you don't know what kind of, I mean, it could be all kinds of, there's a million different stethoscopes out there, so you don't know what kind it is.
Well,
That's,
yeah, I
right.
see what you're saying.
Because I was concerned about, we was just always follow the guidelines of the facility, because we do know how to use it. We already know how to use the equipment because we've been taught that. So that's why I got confused with that question would be,
Yeah. So Paula, the rationale that I'm giving for that, and you can feel free to chime in too, is just any equipment, the thing they're just trying to drive us home. And I don't think it's a great question, again, because typically blood pressure cuffs are something that is so casually used, but it's still a piece of equipment.
Mhm.
So I think what they're trying to get us to think about is if you're using equipment, especially like tympanic thermometers, really, and this is what I'm thinking of most, is make sure you follow the guidelines. So if it says put it in there for 30 seconds, wait till it beeps, that's what they're meaning.
that their instructions and
Right, right,
That makes
follow
sense.
what the actual equipment is saying to do.
right.
Okay. Have another question.
All right,
What-
yes, ma'am.
What is this seismogrammometer, the first one?
Sphygmomanometer. So that is your blood pressure cuff. It's a sphygmomanometer is how you say it. So you just want to take the sphygmo and then it's just a manometer.
Okay.
Okay? All right,
'Cause I
Marie.
was thrown off.
All right, cool.
Yes, ma'am.
You're up, girlfriend. Okay, here we go. This is if one of your patients is from a non-Western culture, he or she may believe that his or her illness is caused from, is it germs, bacteria, cancers, or magic?
I had magic.
You're right, yes. All right.
Good job.
Rob, you're up. Which of the following statements is true in regards to a patient asking you to pray with him or her? A, it is mandatory you pray with patients to make them feel more comfortable. B, it is never permitted to partake in religious beliefs with your patients. C, praying with patients is acceptable but is not mandatory. D, you are permitted to sit with a patient while they pray, but you should not partake in prayer.
It's a tough one, but I would say D.
Actually, it would be C. Because praying's acceptable. It's like we get too political in our heads. If a patient says, I'd like you to pray with me, and that you're comfortable with that, you're perfectly fine to pray with them. But if you don't, you're not going to say, no, I'm not allowed, or no, I don't believe in prayer. You can sit with them while they pray and choose not to participate. But this says that you absolutely should not.
Okay, so it's not mandatory that you do it, but if they ask you to, you could sit there and say, even if you're like a NRP, non-religious preference,
Right.
you could do it, but just to make them feel comfortable.
And you can say, I'm happy to sit here while you pray. Right.
And you don't have to tell them that. So,
Right.
okay, I got you. That's
All
cool.
right. Pam, you are up. Which of the following options best describes what you should do when a patient begins to fall during ambulation? We covered this in class. Hang on to the patient's gait transfer belt in order to prevent him or her from falling. Help lower the patient to the floor by spreading your feet and bending your knees. C, immediately call the patient's nurse for help with the patient. Or last, D, allow the patient to freely fall to the floor.
Lower the patient to the floor by spreading your legs or your feet.
Correct.
Good job.
All right. Lena, you are up. When you remove the soap from your hands during hand washing process, you should always A, use cold water, 2, use a linen towel, 3, keep your fingers lower than your wrist, or D, use your left hand to turn off the water.
Okay, I'm going to answer this, then I'm going to go on mute for a moment. It's going to be
Lena.
keep your fingers lower than your wrist.
You are correct. Way to go, Lena. Thanks.
Mm-hmm.
All right. Marie, you are up. When taking a patient's rectal temperature, what step should you take immediately after you expose the patient's buttocks? A, attach the rectal probe to the thermometer after removing the thermometer pack from its charger. So it's saying add a probe to it. Use your dominant hand to expose the patient's anus. Lubricate the probe using a tissue, or ask the patient to relax and breathe slowly. So right after you expose the patient's buttocks, what will you do? Think about what you would do before you even went to the patient to take the rectal thermometer, take the temperature, and you're preparing to go ahead and insert the rectal thermometer. What would you do immediately after you expose the buttocks?
Lubricate?
With a tissue?
Yeah.
Is a tissue lubricant?
No.
Okay, keep thinking.
You ask the patient to relax and breathe slowly.
That's what I believe it is. Paula, are you in concurrent?
I would say you'd put the rectal probe on, but that's...
Okay. Yeah. Because see, what I'm reading into is I'm saying when taking the rectal temperature, what step should you take immediately after you expose the patient's buttocks? Attach the rectal probe after removing the thermometer. You're probably right. Let's pick you. I was going to say ask the patient to relax.
That's what I was going to say too.
But you know what? I don't think it's right. Paula, you're right. I think.
We'll see.
Yep. All right, good deal. All right, we'll check, Marie. Back to us. Rob, you're up. When taking the patient's blood pressure, where should you place the bell of the stethoscope diaphragm? Is it over the cystic artery, the brachial artery, the femoral artery, or the fibular artery?
Cystic artery.
Try again. It's in the arm.
Fibular artery.
No, that's by the foot.
I guess I got to read this one. Brachial, that doesn't make sense. So
it is brachial. Yes, that's your brachial artery. You have your carotid artery in your neck and your brachial artery in your elbow and your radial artery in your wrist, which is where you get your pulse.
I should have known it
where
wasn't.
You get your blood pressure. Carotid is the one you'll do in CPR. All right. Pam, you're up. When you're giving a resident a partial bath, what's the first thing you should do? Use soap-free washcloth to wash the face of the resident. Protect the bedding by positioning a towel under the patient. Use a limited amount of soap to wash the patient's hands and arms, or verify the water is safe and comfortable temperature.
I think it's you want to verify the temperature of the water.
Absolutely right.
Yes.
You are right. Safety, patient safety, one of the 6 principles of care. All right. Marie, you're up. Which of the following options is not a sign and symptom of extreme blood sugar levels in hypoglycemia? And remember, hypo means low, so they have a really low blood sugar. Will they have a sluggish mood, shallow respirations, a rapid pulse, or clammy skin? So someone that has low blood sugar is going to have 3 of these, but one of them is not correct.
Okay. Rapid is one of them.
A rapid what?
Pulse.
They would or would not have, Marie.
Because we're looking for what's not.
It would.
Okay. Paula?
I'm not thinking that they do.
No, maybe
No?
no.
Oh, no, I'm thinking about the opposite. I'm sorry.
It's okay. No. It's basically because when we think blood sugar, that's the weird thing about blood sugar is they'll be sluggish, they'll seem out of it, but their pulse doesn't typically go up. They get shallow respirations, they get clammy skin, they get diaphoretic is what we call clammy skin. But typically it's not the rapid pulse. You think, Paula?
Yeah, I'm agreeing. Mhm.
All right. We're going to double check. We're coming to the end. I love that we get like curious. Okay. Rob, you're up. One of your patients is diagnosed with depression. While checking his vital signs, he confides in you that he has thought about committing suicide. Which of the following options best identifies what you should do? Report his suicidal thoughts to his nurse, promise the patient you'll keep his secret, keep the depressed patient's thoughts confidential, or discuss with the patient why he feels he should commit suicide.
D.
D?
Yes.
What is one of the biggest roles of our job as a CNA? To observe and report.
Report.
Paula, what do you think?
I agree, it's report. You want to immediately tell the nurse because even if he doesn't mean it, you don't know that.
Okay.
And you may want to, you're sitting there with your client, your resident, your patient, and, tell me more, try to get them to tell you more. But when they tell you they might be suicidal, that is an emergency. You want to let the nurse know immediately.
Wouldn't that be a thought that would be like understood as like, wait a second, I might be able to help this a little bit? I don't know.
No, it's outside of your scope. Yeah, it's
outside of my scope. Okay.
Yeah, in a normal situation, Rob, you betcha. If we're like at a park and we're hanging out with somebody and they're telling you that, you bet you're going to do that. But in the role of a CNA, it's to observe and report.
Understood.
All right. So Pamela, you are up next. One of your terminally ill patients has just had her analgesics increased. An analgesic is a pain medicine. Which of the following options best describe what you should do if they just had their pain medicine increased? Best describes, notify the patient. I'm not sure what this question is saying, Paula.
The first part of it didn't make sense when I saw the first answer, so let me read it again with you.
Yes, one of your terminally ill patients has just had her analgesics increased. Which of the following options best describes what you should do? Notify the patient's nurse immediately, check the patient's vitals every 2 hours, offer the patient additional food or fluids, or watch the patient for a change in alertness. Now I know. Yeah.
Yeah.
You're right.
Me off because that first answer
Me
was just,
too. Yeah. That's correct. Okay. All right. Marie, you're up. Oh, wait. Gurgle survey. What? Okay, fine. I want to skip the survey now. All right.
No, these are the answers.
Yes, they are. Okay, so openly discuss, privately. You are right, Lena Bina. I don't know if she can hear us.
I can see it.
Lena, when the nursing assistant experiences or witnesses another coworker giving them a hard time, he or she should privately discuss with their immediate supervisor
What happened and not immediately to the person.
Interesting. Okay, we're learning. I would have not picked that one. All right, so we got the rest of them. Invasion of privacy. This is one that as a matter of fact, guys, secretly, my gut was telling me I thought it was invasion of privacy just because I thought it was on his thigh and they shouldn't really at all expose his genitals, and that would be a privacy issue. So my gut was telling me something different and I didn't share. So that's a lesson for all of us.
Yeah.
All right, cool. Good to know. We got that right. The rest of them we got right. Oh, we did good, you guys. And it was sluggish mood. Tachycardia. You know what, Paula? We just overthought this in the sense too, because they do have tachycardia because they have diaphoresis.
Mm-hmm. Yeah.
They're diaphoretic. So when you're sweaty, you do have tachycardia. That was our bad. We just totally misled you on that one.
Okay.
All right, that's it.
Lena, I still need your email address, by the way.
You left it on the table.
What's that?
You left it on the table.
Oh, I'm probably sure I did. I was a little shot after that, so.
Yeah, that's all right.
You gave us
Okay.
a lot of information, Paula. Thank you, by the way.
That's true. We do. We have given you guys with lots and lots of information. So
A lot of tools.
yeah, but still it can be overwhelming. So we understand that. It is a lot of information. I'm on Quizlet, and this is under learning. So it's going to give us 4 choices. Let's start, Rob. Let's see, which one of these do you think might mean fork-shaped?
Which one might mean fork-shaped?
Yes. Would it be supra, furca, strict, or neuro?
Be furca.
Right. Furca. Terrific.
Furca.
Okay.
And I don't really know what that means, but it made the most sense.
But it did. And that's what's great about terminology is usually you can figure it out by other things around that word, but you did a good job. All right, Pamela, you're up. A wrinkle or a fold or a crease. Apo, cut, this is a tough one. Rug or med. Gosh.
Wrinkle, a crease. Wrinkle. Rug.
Which one?
Rug.
RUG.
Very good. Rock star. Okay, Lena. Oh, I don't know if Lena can be on or not. Marie, you're up. Hand. Polly, share, frag, or shits.
Yeah.
This is hard.
Yeah.
Well, poly, we know what that means, right? If we have multi-poly,
Many. Mm-hmm.
many,
Many.
right?
And I think share is lip, is it not?
I don't know what share is, but I don't think
I
it's
share Sonny and Bono is what it is.
right. Take a guess, Marie.
Number 2.
Correct.
Well, we'll remember that now after I just said
Right?
that.
See, that's what's fun.
The only
I
one
know.
I actually even recognized was that one in Polly.
I know. All right, Rob, you're up. Sacrum.
Okay.
What would mean sacrum? Tarso, acro, sacro, histo.
Have to be sacro.
You are correct. All right, Pam. Curved, sacro, supra, scope, or skull. Think of a back disease that's very common among adolescents that we look for in adolescents.
What's the name of that disease?
They have a crooked
Yep.
spine.
Say it
Which
again.
one?
School, SCOL.
Yep, you're correct. Like scoliosis. Correct. It means curve.
job.
Scoliosis. Way to go. All right. Marie, equal. Is it micra, iso, sub, or gyn? Gyn.
More than micro.
Sub.
Say it again, Marie. I think you're right.
Sub.
I still didn't know. It's not sub.
GYN, gynecologist,
Nope.
micro.
So ESA.
It is ISO.
Yeah.
And it's ISO meaning the same, equal, isotonic IV fluids. That's something we use all the time. Normal saline is something that's isotonic. It's the same or equal to our blood Plasma. All right. So Rob, you're up. Something that means narrow or contracted. And so we have poster, steno, spaz, or sacro.
Steno.
Correct. Oh, look at this. Press any key to continue. Oh, see, it's going to make us go back to, what did we say it was? Pamela, spell it for me. What did wrinkle, fold, or crease? What was that word?
Wrinkle, fold, or crease.
Yes,
What was it?
RUG.
Very good. All right. Fork shaped.
That was you, Rob, you remember?
Yes. Yeah, it was, no, I don't remember what the term was.
Started with an F. I can't, yeah.
Yeah.
Fulcra, yeah.
Oh, I spelled it wrong. RCA. Fulcra. I spelled it wrong.
Fulcra. Yeah, with
All
an
right.
L.
Okay, so let's see. Marie, which word or terminology would mean gum? Helio, lacrim, gangly, or gingiva?
Helio?
No. Think of go to your dentist, and what do they say you have to floss to prevent? To protect your gums. They want to prevent a disease in your mouth that's inflammation of your gums.
Number 3.
You're close. It's gingivitis.
Gingivitis, right?
Gingivitis.
So remember that itis always means inflammation. Gingiva or gingiv is your gums. So inflammation of your gums. Rightio. All right. Rob, what means new? Neo, apo, necro, or dis?
Neo.
Correct. All right. Pam, what means joint? We covered this one the other day. Is it share, friend, pleb, or arth?
Joint.
What is it?
No, I just repeated it. It's not the first one. Friend. Is that PHLEB?
No,
Nope.
keep going, look at them. Think of a disease that is affecting the joints.
Inflammation of a joint.
HR?
Yeah, arthro.
Very good. Right. Arthritis.
Arthritis.
Good job. All right. Murray, hand. Oh, we've got to remember what the hand word was. How was it?
That was the weird one that nobody knew.
Was that it?
Nope. CH, the one I thought was CH.
Sure.
Or IEIL, I think.
Yeah.
Very good. You were right. I spelled it. It's CHEIR. You were right. Hand. All right. Sacrum. Rob.
Honestly, I'm just looking at them.
That's all right. It's sacro. This one was close to what it was.
Yeah, I had a couple easy ones on this one.
All right. Female. Pam. Is it lig, ren, tri, or gyne? For female.
Ren?
Nope.
Keep reading.
When you go to the woman doctor, who do you go to?
Gynecologist.
There you go. There you go. Way to go. Hey, Lena, are you back? You want to take one?
Yeah, what are you doing?
All right, you're giving us, well, you can't take this one because you didn't see this one earlier. We're doing some medical terminology. So this is FULCR. This is how I tried to spell it before, was fulcrum, but it wasn't right?
Yeah.
It was close.
It was close.
It was close.
FURCA, F-U-R-C-A. Okay. All right. So, Lena, this one's, hand. This is hard.
Can we just skip these?
Yeah, we got it. All right. Skin.
There we go.
All right. Lena, which one of these 4 things down here, these mean skin? Hormone, derma, neum, or capita?
Derma.
Rightio.
Good job.
All right, Marie, what means swelling? Olfact, anti, proxim, or gangly? This is different because we're all looking for itis, right?
Mm-hmm.
Yes.
So there's where we've said before, medical terminology, there's a couple of terms that mean the same thing. So itis means swelling, but so does
Proxy.
nope, that means nearby. Have you ever had a cyst somewhere in your hand maybe where it hurt, but it really wasn't anything to worry about? It's a ganglion cyst. So gangly means swell. It's gangly.
Wow.
Yes. Okay. That was a hard one. That was a hard one. All right, Marie, what means breast? Mast, uri, gastro, or dorse?
Gastro.
No, that means stomach. And think of a woman who might be
see.
suffering from cancer. She might have had her breast removed and she had a what? Anybody, go ahead.
You're right, Pam. Go ahead.
Method.
It is, it's
I'll-
masked because
Yeah, I was
we
gonna say I would
had
go
her
with
breast
mask.
removed. It's a mastectomy. Breast means masked. Good job. All right. Okay, we'll skip this one. Curved though meant scoli, right? S-C-O-L-I.
Yep.
All right. Cavity. Rob, what does it mean by cavity? Is it dent, ventrus, pure, or antra?
Wow.
Dent means, you can think of what dent is,
Yeah.
teeth, right? So
Right.
go for one of those. Pick one.
Well, I rolled 2 up real quick. It's got to be it's got to be 2.
It is 2. You're right.
Yep.
Oh, study this
It's
one.
dent.
Cavity. Ventra. It is. Oh, antra. Ventricle is also one. All right, we're coming back. We got to study that one. It was antra.
These are
It was
all words
Antra?
that we've never seen. That's the problem. This is not
Okay,
in
yeah.
any of our stuff.
All right, yeah, that's true. Fork-shaped we know is furca. Hand we know is share. Hang on, we're going to see if we can get, we're going to go to the next one. We know it's Scully. Yeah. We want to go. Neo. Gum.
Gingivitis, that's simple.
Correct. All right, so Pam, cavity. What means cavity again?
A dent? A dentant?
No, we just had it and I missed it because I went to ventricle. I was thinking ventricle in my head.
It's A-N-T-R.
Yep.
Right. Slender. This isn't a good one either.
Nope.
Burn. These aren't very good. These aren't ones we're using so much.
Yeah, these are really out there.
Yeah, they're too hard. They're really not as common.
Yeah.
So let me go to a different one.
There we go.
And then suffering.
Pain and suffering. Algia, like, right, algia, and it's like analgesia. That's our pain, right? A pain relief. Let's go for dynia. Itis.
Well, I think we all know what itis means.
Itis, right? Swelling. All right.
Yes,
Inflammation. Mhm.
correct.
Malacia.
It's an interesting one.
Oh,